But there are people who are still saying, look, we still don't get completely what cancer is. And one of the things that we want to do during the day is to keep on coming back to that question so that people understand what exactly cancer is. So let me start off by asking you now, from whatever we've been able to understand during the course of the day otherwise, cancer is basically a genetic mutation that takes place, and a cell which would stop dividing constantly continues to divide. And it's a series of genetic mutations that ends up causing that.
Right.
Why does that happen? And what are the reasons for it?
Well, part of it is just chance, I mean, we've got billions and trillions of cells dividing every day. And although the body does its best to keep them in check, sometimes, one of those cells escape the mechanism. The other is the lifestyle you may lead, the kind of food you eat, the environment you live in. Those things are also constantly affecting how your cells evolve. So those are the two main things.
So again, to take that forward, and just to help people who don't understand this, you've got cells that are constantly replicating inside your body. And when there's the wrong mutation that takes place, then the cells start to keep on dividing. The suppressor genes which are there don't act on it. That can happen either because of chance, as was just said. It could happen because of environmental reasons or hereditary reasons.
And genetic, yeah.
Genetic reasons, essentially. Or it could happen because of things like tobacco and alcohol and obesity and
lifestyle, the other environmental toxins which we get exposed to. You really don't know, for pesticides in your food, to the environmental air, to radiation exposure. There are innumerable things which can come up to. It's always more than one hit which is required to keep this going. So you need 2-3 things to come together, and then this goes out of control. Normally the body also has a mechanism to knock off this cancerous cell because it's seen as abnormal. So there is immune mechanisms to actually control it. When that mechanism is overcome, then you have a truly cancerous proliferation occurring.
So the body's immunological response also has to go. So actually you need a series of events to take place before cancer should theoretically kick in. So it's almost baffling as to why so many cancers are happening. Is it just because we are surrounded by too many carcinogens?
Carcinogens and just the number of cells, I mean, there are so many people and there are so many things happening that how much ever you try and keep this in check, there is always going to be this one cell which is going to go rogue.
But one of the biggest carcinogens, which is cigarette smoke, should actually be on its way down because people aren't smoking as much as they once used to.
Right.
So theoretically, that should start kicking in at some point. So I mean, what's the number? 20-25% is caused because of tobacco?
Yes, but now, in India at least, we had the highest incidence being head and neck cancers, in addition to cervical cancers, and among children, we've already discussed during the day about leukemia, where you really don't have any causative factor there. But then just by controlling cigarette smoking per se, still hasn't brought down enough of tobacco usage per se in India still.
So there
are still other things. And we still don't know about environmental toxins which are now kind of part of our daily life. We don't even know. So Vikram, like you said earlier, one aspect is how come somebody is getting. The other way to look at it is how come with so much around, so many people are not getting it. In spite of all this kicking in.
All right, well, you are going to be helping us as implementation partners. We just saw Kiran Mazumdar came on a little earlier in the day, and she said 2 crore rupees is what she's pledging, and a lot of that will be utilized. Let's just take a look at someone like Chaya, who did come to you without hope and went back a completely new person.
The Masoomdar Shaw Cancer Centre, MSCC, at the heart of Narayana Ridwalaya Health City in Bangalore. MSCC is an initiative promoted by Biocon founder Dr. Kiran Masoomdar Shaw. Its guiding principles are based on the philanthropic ideals of the founder of this health city, Dr. Devi Shetty, a renowned cardiac surgeon who was awarded the Padma Bhushan for his work in the field of creating affordable healthcare.
The Masoomdar Shaw Cancer Centre was really something that I was very, very committed to in terms of affordable cancer care. Cancer is not only a life-threatening disease, but it is psychologically debilitating and financially crippling. And as someone who has, seen cancer at very close quarters, because very close friends and my own family have actually dealt with cancer in a very difficult and challenging way.
So MSCC delinks cancer healthcare from affluence. It provides world-class health services in cancer to the masses at a cost that is affordable to all. This apart, MSCC is a world-class research hub and training college in oncology. It is also the first cancer hospital in the country to facilitate organ-specific treatment.
Our interest is that we should be able to do the genomic mapping, find out what is the chemotherapy that actually is appropriate to you, not just to the cancer. And so if something is not appropriate, we do not give it or we stop it. The whole world is actually coming to India to receive holistic care. So from pastoral care to spiritual care to Indian integrated medicine, that is from yoga to anything that is. See, our intention in this whole process is this. We'll provide the best of science and marry it with all the other elements which actually align the person's body to improve, for survival or improvement.
So one of the things that you've been talking about are personal care tumor boards. What exactly does that mean?
So we've seen, traditionally there are differences between Indian patients and the Western population. So we can't just take Western protocols and just put it into our population because our genomics are different, the way we handle drugs is different. And we've seen that diseases behave differently in our subset of patients. So it makes sense to say that one is genetic variation from our, from our origin per se, plus individual variations. So some people handle drugs different from the other person. So it helps to pick up those subtle differences so that you tailor make your best chemotherapeutic agent upfront rather than try and use it, when he's relapsed, when you've kind of lost most of the, the fight which you could have.
One of the things that I've been picking up from some of the research on cancer internationally is almost to say that every tumor is different, that every cancer is different. You can't just say lung cancer, it's all the same. It might arise from a different specific genetic mutation. And therefore, sometimes what you do when you're saying chemotherapy and radiation is you're firing a bazooka when a sniper rifle may be better.
Right.
Would you agree with that?
Absolutely. So that's why the next evolution of cancer treatment is going to be targeted therapeutics. You identify the exact mutation that is causing the cancer, and then you go with the specific molecules which just kill that and nothing else. And that is essentially what is personalized medicine.
But for that you need great, and one of the other big concerns that is happening in the West is that you've got these various different cancer centers and their databases don't necessarily talk to each other, because for what you're saying to effectively work out, surely you will need a better database that people all across the world can access. That's when you will know that, okay, this is the genetic mutation that is taking place for this person in Bangalore. Now, somebody somewhere in Poland had a similar case and we tried this therapy and it worked for that person. Right. For that you need a database, don't you?
Yes. So that's the difficult part actually, Individual centers start by themselves, but somewhere down the line, unless you collate data, it'll not really help anybody's cause, because each one has his small subset of data and he thinks that he's got everything there, which is truly not there. So this is something which I think we need to spread the word and encourage institutions to collaborate. I think we are taking steps towards that direction for sure. That will certainly go a long way. And if you talk to most people, you know that our subset of patients do behave differently. So it makes sense to treat our patients different.